For patients with metastatic or advanced urothelial carcinoma, beyond platinum-based chemotherapy, immune checkpoint inhibitors, we now know enfortumab vedotin, as well as the subset that happen to have a pathogenic mutation or fusion of the FGFR2 or 3 pathway, that remains an unmet need. So there are patients that still have a performance status that warrant additional therapy, but there's not a lot of options. We know that sacituzumab govetican is an antibody drug conjugate that's approved currently in the United States for triple-negative breast cancer, has some interesting and promising data for the metastatic urothelial carcinoma population, with initial data on 45 patients presented a couple of years ago at the Genitourinary Cancers Symposium, with promising data, and then a prospective phase 2 trial of 113 patients in the TROPiCS-01 study presented at ESMO 2019 and 2020, with a response rate of 27% and a heavily pretreated patient population. That drug, now with breakthrough designation, could in theory receive accelerated approval like enfortumab vedotin has currently, but we really expect that EV to have full approval soon. So that has led to what is a potential confirmatory trial, which is TROPiCS-04. So that's a phase 3 randomized trial of men that have had at least platinum-based chemotherapy as well as an immune checkpoint inhibitor. There is no limit to prior therapy as long as at least one of the control drugs is available. Most explicitly, that I don't think that everyone captures. That means that patients could have received enfortumab vedotin, although that is not required. Patients could have received an FGFR targeted drug such as erdafitinib, although that is not required. So any one of those or more is allowed prior to enrollment in the study. So as long as the patients maintain a performance status of 0-1, they can enroll to receive either randomized to sacituzumab govetican at the same dose and schedule as before, day 1 and day 8 of a 21-day regimen, versus in the United States or locations that don't have vinflunimab approved will be either docetaxel or paclitaxel. And in countries where vinflunimab is approved, they could get that drug as well. That is a study that has been activated with the endpoint of overall survival. So hopefully for our patients, we may have availability of that drug. I guess technically we have that available off-label today, but hopefully there is accelerated approval of that drug. But in the meantime, a phase 3 randomized trial has now been initiated, and we hope that that leads to worldwide approval for this promising drug down the line, because our patients certainly could use additional therapy when available.